Great. Good afternoon from Philadelphia, everyone. We are very glad to talk about this topic today. We have a lot to share, so we'll get right started talking about making accessible domestic violence resources.
Thank you for attending the webinar. We are offering Spanish interpretation today. So please look in either the three dots or the globe icon. You can click there and then pick Spanish. Gracias por participar en este seminario virtual. Estamos ofreciendo traducción en español o interpretación en español. Si usted mueve su señal donde están los tres puntos o donde está el icono del globo terráqueo y lo marca ahí, puede buscar español y empezar con la interpretación. So thank you everybody for being here. We have several panelists that we are going to get to introductions at some point, but my name is Azucena Ugarte. I am the director of the Office of Domestic Violence Strategies at the City of Philadelphia. And this is a presentation about a project that we've done in partnership with several partners, not only from the City of Philadelphia, but also from the state. How the project started is we wanted to create materials with specific information about domestic violence, but we wanted the materials to be very easy to read and to be linked to videos in which more information could be provided. There's a lot of materials out there about domestic violence, but they tend to be wordy, and that makes it, on one hand, not so easy to understand according to literacy levels, but also when we try to translate those materials into other languages, a lot of the meaning is missing. So in order to do these materials, we realized immediately that we couldn't do it by ourselves and that we needed the input from the experts that do this work in the community. So these are the experts here in this panel. So I'm gonna let first my coworker introduce. Also, I want to be clear, this was Liz's idea. So Liz, you can take a bow. And then after that, I would like everybody to introduce themselves. Thank you.
Hi, my name is Liz Pride. I'm the Senior Project Manager for the Office of Domestic Violence Strategies. And I will pass it to my colleague, Daisy.
Can you hear me? Can you hear me well? Okay, good. So Liz, you want we introduce ourselves and also said why we get involved?
Yes, tell us why you're on this team.
All right, thank you. Okay, so my name is Daisy Rodriguez. I use pronouns she and her. I'm the Director of Language Access Philly here in the city of Philadelphia, based on the Office of Immigrant Affairs. So I get involved in this project for multiple reasons. Personal reasons, I could support the project with my language skills. I'm Brazilian, so I speak Portuguese. Here in Philadelphia, Brazilian Portuguese stands out as one of the top languages requests for interpretations and translation services, second only to Spanish, not a surprise. The growing demand of the Brazilian Portuguese interpretation translation just reflect this vibrant and expanding Brazilian community here in Philadelphia. So the projects recognize this fact and includes Portuguese as one of the languages. I also personally, I am a survivor who received help from like different organizations, hotlines. So I truly, deeply believe in this mission and in this project for knowing these resources out there really help and change lives. Professionally, as the Director of Language Access Philly, I support Liz Pride, who is the Office of Domestic Violence Strategies Language Access Coordinators, to access these services to reach out to our multilingual communities here in Philly. And the way our program model works is thanks to the work of those languages access coordinators like Liz, who are responsible for implementing initiatives to reducing these language barriers and making sure the right of our residents to receive crucial information like this and public services, no matter the language that they speak. Thank you so much for the invitation. I'm so happy to be here and share what we learn about this project.
Thank you, Daisy. Can we get the ODP team to introduce yourselves?
Sure. Hi, good afternoon. My name is Leah Sheffield. I work for the Department of Human Services, the Office of Developmental Programs, otherwise known as ODP. Here in ODP, we support individuals with intellectual disabilities and individuals with autism or autistic individuals. So we are here as subject matter experts in that area for individuals who may not speak with words, may use other modes of communication, and may need plain language or easy read to understand complex information. And then with me is my partner, Laurie.
Hi, everybody. I'm Lori Milsick. I'm the Deaf Services Coordinator in Leah's unit for the Office of Developmental Programs. And she already mentioned that we're here to kind of advise as subject matter experts for plain language and the folks with intellectual and developmental disabilities. I also bring knowledge of sign language and interpreting skills and just advising on some of the language that was used, as well as connecting with the deaf population a little bit. And I'm glad to be here too. We didn't do most of the heavy lifting on this project. We just advised a little bit.
Thank you, Lori and Leah, for very important parts. Molly, can you introduce yourself?
Hi, everyone. I'm Molly Sadowski. I'm the director of ASSERT in the Eastern region and based at Drexel University in Philadelphia. So ASSERT is the Pennsylvania Autism Services Education Resources and Training Collaborative. And we really work to provide resources and training and education opportunities to autistic self-advocates, healthcare providers, and other professionals, parents, families, communities to really support the autism community across Pennsylvania. So we got involved in this work as we partner very closely with and we're funded by the Office of Developmental Programs and the Bureau of Supports for Autism and Special Populations. So we work very closely with Leah and with Lori out in ODP. And this project was really aligned with a lot of the work we do to create accessible resources for the community. So we supported the graphic design elements of this project and the focus groups with some self-advocates to inform the design of the materials.
And you'll get to hear more from all of these people later too. And then May, can you introduce yourself? Oh, for a second you looked frozen, but I see that you're multitasking.
I'm very sorry. My name is May Reale. I have the honor of working for the Pennsylvania Coalition Against Domestic Violence. And I wanted to be a part of this project, first of all, because Liz is amazing and everyone on this team is amazing. And I just, anytime we can spread any kind of information and awareness, especially in the beautiful, simple ways that they have been created, I'm always down for. And so we were able to, kind of share this within our network of 59 DV programs. So just super thrilled to be here and be with you all today and grateful to learn more.
So you heard a little bit from our team, but when we started this project, we knew that we couldn't do it together. That's why we assembled this team to get us started. And then the trajectory of this project is that we then worked on creating a survey and going out into communities to get feedback about what these materials should look like, because we had kind of a certain direction we wanted to go in, but we're really wanting to get feedback from the communities that would be using these resources, what would actually be useful. We followed that up with doing focus groups to get some additional feedback about that process and what resources would be most useful to people. Then we started designing the actual resources, making the scripts for the videos and the format for the brochures. We made those brochures and videos, and now we're in the process of sharing them, which also includes sharing about our process because this was a really interesting project. And I think we've learned a lot of things that would be helpful for other people who are looking to make resources easier to understand and more accessible for different communities. So starting with the survey, we had a small amount of funding from the Innovation Fund, which is an internal fund from the City of Philadelphia that helped with paying for translation and paying for gift cards so that we could compensate people for giving us feedback. So we designed a survey that had mixed questions, some open-ended questions and some multiple choice questions. And we went out into communities to find out what people thought. We were able to get a pretty diverse representation, really intentionally, from the different communities that we were hoping to reach with these resources. We had pretty diverse race and ethnicity reported by survey respondents, as well as language. So the survey we wrote in English, in plain language English, aiming for a 4th grade reading level, had that translated into each of these languages, and then brought those out to different sites where people were able to take the survey in person. And then they received a $25 gift card for contributing to the survey and giving their feedback. So most of the survey responses were received not in English, in all of these other languages, which we're really proud of, that this was something that we aimed to do and were able to do through this project. And then we also, it was 50 survey responses, in case I didn't mention that. So what did we learn from the survey? We asked a number of different questions, including getting people's opinions on different definitions. And then we asked them other questions about prioritizing what types of information would be most helpful for them. So one of the questions asked, imagine that you're looking for help for yourself or someone else about domestic abuse. What information would you want? And we gave them a number of options that they could rank from 1 to 10 on a scale of least important to most important. So across all of these different sites where we went to do the surveys and different groups that took the surveys, if you see on this screen, the responses or the options that have blue and green are ones that people were in most agreement about being most important. So they got ranked higher. The less green and blue are ones that tended to have fewer people rank those as really high. And when you see either the gray, which was ranked as a 0 as not important, or red and orange is kind of on the lower level of importance, we got a feel for what types of information people thought would be most helpful, especially in these initial outreach materials. So high on this list, how to protect your children, how to protect yourself, what your rights are, and supports and services in my language or culture. And then pretty close behind that, where to get counseling or support. Things that people were a little bit more mixed on were legal help, examples of what abuse is, how to stay safer in your relationship, what happens when you call the police, and where the person doing the abuse could get help. So this helped us think about what information to include in the resources that we made in the end. We also asked where people get information when they or someone they know needs help. So not just necessarily about domestic abuse, but any type of resource. So people could rank different options as never, sometimes, often, or always. And this was also really interesting for us to see. I think in some ways not that surprising, but helpful to see that people first go to trusted friends or family. They go to trusted professionals like social workers, doctors, nurses, and websites with video or audio information, much more often than websites with text information, which was helpful for us to know, especially since our goal with this was to make videos and reduce the amount of text in the resources, because that was something that people don't engage with as often. And this, for the most part, was pretty similar across different groups. We had a little bit of difference between some specific language groups of where they would get information. For example, deaf respondents were very likely to go to websites with video information and really not likely to go to websites with text information. And there were some communities where people would go to a religious or spiritual leader, and others where they really did not want to do that. So that it really speaks to wanting to know where people get this information, and also that there's a really broad range of places where people do actually go. There's sometimes or often to get resources about where to get help. So we wanted to know that so that we could think about where to distribute these resources in the end. And then we also showed a easy read example created by a nurse in England who works with people with intellectual disabilities. So she had made a short brochure that was very icon heavy with information about domestic abuse. And we had whatever little text was on that translated into the same languages for the survey, and showed that to people in the survey to get their feedback about whether a resource like that would be something that they would be interested in. Did it help them understand the information? Because we didn't know if there would be differences across different languages or different communities, if they would prefer that or not. And overall, we found that people really liked that, and that it was actually very helpful in helping them to understand what domestic abuse is, that the icons were helpful in learning about what types of abuse were, that it was easy to read, especially having few words on it, and that for a lot of people, it would be a resource that they would feel comfortable picking up or sharing with somebody else. So that was really helpful for us to realize that we're on the right track with finding this information and connecting it with imagery that would help make it easier to understand. And then also, because we did these surveys in person, this was a part of the survey where people often told me things about the survey that they liked or didn't like. And so we had a lot of conversations about icons and things. And a lot of times people would point something out and say, this is a very bad icon. And I would ask, oh, do you not like the way it looks? Is it offensive? Should it be something else? And they would say, no, this is a really bad behavior. I think people should know about this. This is a good example to include. So it was really helpful to do it in person and be able to have conversations with people about what was working for them and what wasn't. And we learned a lot there. And then after we did surveys, we did focus groups. So I will hand it over to Molly to talk about their focus group.
Thanks, Liz. Yeah, so ASSERT partners very closely with a group called Self Advocates United as One, or SAU1, and they support a lot of projects like this, and often develop resources with us or review content that needs to be made accessible and shared with the Pennsylvania community. So they were a really perfect group to partner with in this work as we developed the easy read and plain language materials and the videos. So we have sort of standing meetings with representatives from that group. So in one of those, we had shared some of the domestic violence resources that were developed in the UK that Liz was just talking about, and some of the videos, and sort of had a conversation about what they liked or what they did not like about these resources. So generally, the feedback from the group was pretty positive about the simplicity of the resources. They relayed, for example, that they would be really comfortable with sharing something like this with someone they knew that needed help, which I think is really important for us to understand, because that was one of the primary goals of this project, making sure that people have access to resources, that they know that there is support. They also offered a lot of really helpful suggestions for including other examples of domestic violence beyond what was on that UK resource. So things like not allowing someone to work, controlling social media access, controlling friends, destroying personal property, not allowing someone to ask for help, not letting someone make their own decisions. So a lot of these are examples that ended up making it into the final brochure, which I think was really helpful to just hear from that group about some examples that might not be so obvious that would speak to this community. The group also very importantly shared barriers to accessing help that I think informed the development of the brochure and the video. So things like fear of retaliation, and needing, a person for care and for support, lacking support or support systems generally, lacking awareness of programs and services or availability of programs and services, as well as lacking consistency in information that's shared across counties, for example, in Pennsylvania. I think all of that was really helpful in our design process and was fed really directly into the development of the brochure and the video. I think Lori and Leah are next to share a little bit about the other focus group.
Susanna is going to share about the other focus group.
Oh, I'm sorry.
It's okay. Thank you, Molly. I was waiting for my cue from Liz. So the other focus group that we did was with bilingual advocates. They would be advocates from the communities whose native language was either Arabic or Portuguese or Spanish, but who also spoke English. So the focus groups were actually in English, but they were able to provide their input according to or based on their experience with their communities, because they were working in the communities with communities that only spoke those languages. Not surprisingly, one of the first things that came up about priorities to put in the materials were issues about confidentiality, and trying to, for us in the materials, to be as clear as possible what information is confidential, if an immigrant that is being abused, an immigrant that is experiencing domestic violence, reach out for help, how that information is shared, what things are confidential. So something around being very clear that domestic violence resources are confidential, or if they are not, also to make that clear was important for advocates. The other thing that that came up from the focus group was, and we struggled with that, I think, during the process of creating the materials. On one hand, they wanted very simple language, very clear, if it's possible, very, very few words that match the image or the icon. So it reinforces the understanding for the word with the icon. And at the same time, they wanted language that, or words, they wanted us to be careful about using words that then when you translate to a different language doesn't make exactly the same sense, or culturally it doesn't exist. So it was like, we want few words, but for some things you may need to explain what that word means. And in the case of the domestic violence word, one of the very common terms that we use is safety planning. Right. And safety planning have very specific definition for us. We understand when we say safety planning what it is, but when we translate it to a different language, that may not make sense for the person. So they were like, it should say something about the plan that you create so you make sure that you are safe. But at the same time, we want fewer words. So that reinforced the idea of we need to have two platforms. The reading materials that could be few words, simple, and then the videos in which the explanation could be expanded when somebody could say like, this is what it means, et cetera, et cetera. We can have more information there. Other things that came up also, for example, where to distribute the materials. Liz mentioned this a little bit. From some community advocates, they were very clear, well, we have clinics. We have health clinics where we can distribute the materials. For other community advocates where, well, the corner store, it was different. Like, it was like the faith-based organization. So depending what relationship the community have with different organizations, it could be something kind of more formal or more informal. There was also conversations about using social media and what type of social media platforms community use. And in the case of immigrant communities, could be different than what platforms that Americans are used to. And Liz is going to talk a little bit about that also. And then something that came up about the videos. When we ask, who would you like to be in the video? It was also very clear that they wanted somebody who looks like me, somebody who is from the community, somebody that is almost like a conversational video. And they wanted also a message in the video that connects with people. A message in the video about, we know how difficult this is. So not just the theory, this is what it is, and this is where you can get help, but also that connection that we know how difficult this is. We've been there. There is help. I think that's my main takeaways.
Thank you. And then Molly, can you talk a little bit about, after we got all that feedback, then we went to the graphic designer with how we put this all together.
Yeah, absolutely. So we worked with our graphic designer with a cert who is really well versed in not just graphic design, but accessible graphic design. And she was able to incorporate a lot of the feedback that we got from these groups. So making sure that font size was big enough, that things were easy to read, that the colors were all appropriate and adhered to all of the accessibility guidelines, all while creating something that was really visually appealing with a ton of information in it. So she also had recently attended a national accessible design conference, graphic design conference, and so had created like a quick reference guide for us that I think we'll be sharing after this webinar. But she learned a lot. This is sort of a developing field, and you know, I think there are some best practices that we can learn from developing really nice resources that take into account all of these accessibility considerations, but still creating something that is really visually appealing and easy to understand and is accessible.
Thanks, Molly. So we created things that are relatively simple, but that doesn't mean that this process was without challenges. So we want to talk a little bit about some of those challenges. And so I'm going to turn it over to Lori and to talk a little bit about the reflections.
Yeah, so part of my role was to help gather up the deaf community in the area and help to get some more of that input that we've mentioned already from those native language users. The difficulty that I ran into, and I've, like you said, been reflecting on what might have been the causes or how I could have done things a little bit differently. And what I'm thinking about is the difficulty of finding one place where a lot of deaf people go, right? So there are some of these kind of hub locations where they tend to congregate. However, what I found was that the topic of domestic violence, domestic abuse was a difficult fit with some of those hub locations. I found that people were a little bit hesitant to maybe talk about that topic, or they misunderstood that we were only looking for people who had had that experience, where we really were looking for people from all different kinds of experiences, whether, you know, someone in their life has experienced domestic abuse or whether nobody has. We just wanted to find out what they would like to see in the materials and how we could get those materials out to them. So I think some of that confusion was out there, and I think in the future, if I were to do this again, and if somebody attending today was interested in doing something like this, I would start planning a lot earlier. I would really go and meet with people in person as well. I was located a little bit farther away, and so that in-person piece with the deaf community is just so valuable. I think I would have made that a higher priority. And then we did have the ability to meet with folks in those hubs. You know, they're places where certain folks congregate, but the difficulty with that is it would be a certain specific group, and then we would be excluding a whole diversity within the population in the deaf community. So, yeah, so just a lot more planning for myself, I think, in the future. I certainly learned a lot about better ways to approach something like this and really finding people in the community who understand the project very clearly and are willing to advocate moving it forward alongside with us. So that's the difficulty I ran into. And I'm sure it's not unique to the deaf community as well. I mean, a lot of folks who share a language tend to congregate in different places. And so just thinking about who you want to have surveyed and what diversity you want in your population is one of those things that can become a challenge.
Thanks, Lori. And we were able to get survey responses from deaf individuals, which we did it because we did it in person. There were a lot of benefits to doing surveys in person, even though that takes a lot more time and people power to do that. But because we did it in person, I had an interpretation team with me. It was a very open conversation during the experience, because people didn't just read the survey and take it, they had it interpreted to them and then did the responses after seeing the interpretation. So and then there was a lot of questions and discussion that came out throughout that. So it would have been great to do a focus group with the deaf community, but we're not able to do it on this one. And then on the topic of language access, I'm going to invite Daisy to talk with me about that. But we set out with this project proposal. We had 9 languages identified and translated the materials into the 9 languages that we decided that we were going to target. And for the most part, tried to set out and find all of those people. It's hard. The finding community places where people would be willing to do that. I don't have the slide up, but we had the slide of the language distribution of who took the survey, and it was not perfectly even between the languages. We had more representation for Spanish, because there are quite a lot of people who speak Spanish in Philadelphia, and that's pretty easy to find. We had fewer people, maybe one or 2 responses from people who spoke Vietnamese or Mandarin who took the survey. And so it was not a perfect, even distribution. And I was not able to find anybody who spoke Bengali, even though we tried a lot of outreach to different community organizations, and some were just interested and we couldn't pull it together in time, and others, it's just, as Lori mentioned, not having prior relationships makes it a lot harder to get that community involvement. I'll turn it over to Daisy, who is our language access expert.
Oh, Thank you, Liz. I think your project, like as Susana was mentioned before, uses a great model. Like the first thing that we recommend is go to the community, talk to the community, talk to the experts, survey people. Even if you cannot survey like folks that speak Bengali or speak Portuguese or whatever language, you reach out, maybe leaders in the neighborhood, trust messengers can support you and inform. So like that is definitely a model that we recommend. We use that model before in other projects in the city when we are translating the website, phila.gov, in multiple languages. We had focus groups, so we know it's a great model to start, and also for sure compensating our community members for working and sharing their knowledge, their expertise with us, and was exactly what this project did. Like very generally, it speaks is not like one size fits for all approaching to equitable language access services. So we need to be flexible, we need to be adaptable, we need to be curious about the process, and we're going to be learning, and it's not going to have perfection, right? Liz, we're sharing, like we could not reach out to Bengali speakers, so it's not perfection. We do like the best we can, and the city of Philadelphia, besides the language access Philly, has a great resource. So I recommend everybody take a look in the equitable community engagement toolkit language access guide. So this guide has a lot of best practices to reach out to this community. I can drop the link in the chat. Besides language access, is multiple other guides to instruct and oriented the best equitable community engagement you can do in the communities here in Philadelphia. So it's one of recommendations to definitely check this toolkit. Other than the toolkit, like we always like to recommend 3 elements, and this project like was focusing those elements: data-driven approach, tailored outreach, and equity considerations. Our program Language Access Philly, because of experiences translating Phila.gov and also assisting the entire city departments, we highly recommend 10 languages for multilingual outreach here in Philadelphia. The languages are Albanian, Arabic, Chinese, French, Haitian Creole, Brazilian Portuguese, Russian, Spanish, Swahili, and Vietnamese. So this is like among the most common languages here in the city, and widely spoken in the city of Philadelphia. Liz is now showing our city language access data dashboard. So this data is a collection of that data from the vendors that provide the services, translations and interpretation services in Philadelphia. Not all the vendors, we do not have complete data in this dashboard for ASL. So Lori, that's something that we need to work on it, because we have a office that is dedicating for that. So maybe we need to think about partnership with this office to include this data here. But I want to acknowledge that as ASL is also a language and is also wild speaking in Philadelphia. So this dashboard can definitely orient it and give some data and facts for people who wants to reach out to multilingual communities. You're seeing this is the overall data here. So we have the numbers of interpretations and translations. We have a language list. So you're going to see like Spanish is again the most spoken language in Philadelphia, second Portuguese, and so you see the more than top 10 languages right here. You can filter too by department, so you can choose an agent. So if you like doing a project that is more like involving healthcare, so you can filter by the agents like public department and see how the public department data is different than the overall data from the city. So if you're doing outreach that is that the mission is very similar to a mission of the safety of Philadelphia, you can see how 911 is responding, to these multilingual communities. So it's multiple ways to explore this dashboard. And another way is the map. So Liz, if you can click in the tab map. Do you find?
Oh, I see.
Map?
I was going to ask.
Yes. So this is data from that we use to recreating, visualize, map geographically of the languages spoken in Philadelphia. This is based on the 2023 American Community Survey, ACS 5-year estimates. So if you explore this map, you can see the percentage of languages spoken in zip codes in Philadelphia. So this also is a great tool to start with your mapping the languages that you want to reach out to Philadelphia. So besides our dashboard, we definitely recommend take a look in the census, take a look in this map. Census usually is not the most updates and information, but sometimes it's not major errors, it's minor errors. So definitely take a look in the census, but with critical thinking, because they tend to group languages in a very weird way. So the city of Philadelphia have a linguist. Khalil Thomas is actually in the audience, and our linguists that group our languages more mindful than the census. But the census is also data that we recommend you take a look. Another data that you can take a look in Philadelphia is the school district data. So the school district also has a dashboard and collecting data from the households in Philadelphia. And generally, you have Pew Report, Migrant Policy Institute, and resettlement data that can support you to figure it out. Languages is spoken in Philadelphia and nationally is speaking. Also, we are here, Language Access Philly team. We are a small team. We're brave to consulting with anyone who wants to consult with us. But again, I like to say, your mission, your office, your residents. So talk to the community and do the best you can. You're the expert, and so trust the community, trust your surveys, and put this data together, cross information, and you're going to have good intentions and good results with this. And we are always here to help to support externally and internally our offices, and also externally people who are doing great work with multilingual communities.
Thank you, Daisy. And I think we have a lot of great resources in the city of Philadelphia. I'm biased, I work for the city of Philadelphia, but we also really intentionally with this project worked with our partners in the state, so the Office of Developmental Programs, and with PCADV, because we know that people who live in Philadelphia go other places, and they move into Philadelphia and out of Philadelphia. And this information isn't just specific to people in Philadelphia. It would make sense to make it more broadly available to everyone. So we were really glad to partner with our partners who are looking more at statewide issues to get their perspective. So I'd like to invite Leah and May to talk a little bit about the plain language piece, which hopefully is a term, maybe it's a term that you've heard before, maybe it isn't, but is something that was really important in this project.
So I think for me, especially in terms just in general in thinking about domestic violence, there's so much jargon right? There's so many pieces of things. And I think also for so many folks, when they hear the phrase domestic violence, right away their brains go to like, oh, yeah, I know what that is. And what I find really valuable about this project is you were trying to be really expansive about the many ways in which people are experiencing that like loss of power and control. But as Asusena says, first of all, it's not always the same across every single space, right, that folks are in, but also not always understood in the same way. And we sometimes have a tendency to want to put too many words in. So keep trying to like boiling it back and back and back to make sure that when folks are looking at the photos or they're looking at the image, if it's something that tracks for them or someone they care about, they know this is available and applies to them as well. And I will stop talking because Leah.
I think we lost you there, May. But thank you. Yes, this is Leah. I just wanted to just share that, plain language is really so important. It really improves accessibility for absolutely everyone. It is not just for people with, cognitive disabilities. It's not just for people who use English as a second language. It is for everyone. It makes all of our lives easier. However, I do think it's hard to do. In school, we're taught to add those adjectives to, really make your sentences robust. And plain language does kind of the opposite of that. We're using less words. We're using more everyday words. We're using shorter sentences with less punctuation. So it is kind of, a challenging task. And it takes lots of practice and work and collaboration to really get it right. And even, now that we're done, I still think we can always do better, which is a challenge. And I think for me, something that I really loved about this project is that we didn't just do written information, we also had videos because a lot of individuals take in information differently, right? For me, I can read things and take it in, but I can also take something a little different from the same thing being spoken. So having those two different modes of communication, whether it's written or auditory, I think is also a really cool thing about this project, to make sure that the information gets out there and is accessible to all individuals.
Thank you. So we've been teasing. Oh, Lori, do you want to add something?
I just wanted to add a thought that I had about plain language. Being a multilingual person, I think, is really helpful when you're working on creating a plain language material. Specific with sign language, I find myself at times going, well, it's the same sign. If we're all arguing over one word, should it be this word or that word or, so sometimes that helps me to focus on, what's the most important piece to put into that plain language. And I think that's true with other languages as well. Like Asusena brought up, some words just don't translate well. And it's helpful. And I think someone in the chat mentioned too the transcreation of a document, and specifically with plain language is so helpful to do in the design phase. And it's another thing I love about this project and what Molly had said earlier. Just it sounds like a lot of work, and it is a lot of work, but doing all this stuff in the design phase makes it so much easier because often we see projects being completed and then having to go back and say, well, let's make these icons different, or let's make this more plain language, or what about this language and that spoken language community? So yeah, I really appreciated that kind of collaboration on this specifically because we don't see that as much in our office.
Yeah, so we have been teasing what we made with all this information. So now I'd like to get Molly to talk about the actual brochures. So now you can see on the screen.
All right, the big reveal. So this is an image of the brochure that was created. So you can see that we have a little bit about the definition of domestic abuse. We have some information about how it can happen to anyone, regardless of gender, sexuality, age. And then we have some examples of domestic abuse. I had shared earlier about some of the examples that had come up in those focus groups, so we made sure to incorporate some of those here as well. You can also see that the text is super simple. It's very easy to read just visually. And then going toward the right side of the inside, you can see that we have shared some information about how domestic abuse can impact the health of yourself or of your children. And we have some examples of what this might look like. And then on the outside, we have sort of the action steps on what to do and who you can talk to, where you can lean on some support and professionals to reach out to, who you can feel safe talking to, and how to contact all of these different people. And then we have highlighted here just the QR codes, which I think was a really helpful addition to these brochures. So you can scan these QR codes that are available in all of the different languages that Liz had mentioned earlier, as well as including ASL. And so you can scan that QR code and you can link directly to the videos, which I think we're gonna share with you shortly. But I thought that was a really nice additional feature to give options for taking in this information in a couple of different ways, all within just one brochure, one pamphlet.
Thanks, Molly. So on the next slide, I think it might start playing automatically when I go there. So it's not exactly the video that you'll see if you scan this QR code, but we put together a highlight video that of the first 6 videos that we did. So you can see that they are real people. And as Daisy mentioned, she is one of the real people who's in the Portuguese video. So we've got like a quick highlight reel, but each of these videos is about like between 6 to 14 minutes, depending on the language, and goes through all of this information in more depth.
Hi, I'm Kalia.
Meu nome é Daisy.
Moi, relé Bidley.
大家好，我的名字是Jen.
Sou Suhai. E eu estou aqui para compartilhar informações importantes sobre o abuso doméstico.
I know this can be an uncomfortable topic.
Pero esto podría ayudarle a usted o a alguien que conozca.
Parce que l'été utile au monde qui me connaît.
El abuso doméstico está mal.
If someone is abusing you or someone you know, help is available.
Pode parecer assustador, mas você tem o direito de fazer suas próprias escolhas.
Y no está solo.
我知道这是一个棘手的话题，但这类信息能帮助到很多人，或许也能帮到你。
Pour contacter un monde jodi a, relé li direct sous violence domestique 24/7.
So that is just a preview. You can see all of the videos on YouTube, and we have a little bit of time for questions. So there are questions. Please feel free to use the chat or Q&A. I'm not sure where that is because I have a lot of screens up. But we'd be happy to answer questions that people have. These resources have been out in the world for about 3 months. So we are giving the brochures out, people are watching the videos, and you can access them all with these links. You can download the files of the brochures or watch the videos, as well as request printed brochures to be sent to your site. So I'm going to see if there's any questions. I think anticipating that people might be curious about who is using these or are these being used, we do have some appendix slides with information about what we've done so far in the 3-ish months that we've had these distributed. So with the brochures, we have shared these with a lot of different organizations so far, from the request form where people are asking for printed copies of these. About 50% of requests have gone to departments or teams in the city of Philadelphia, meaning the government departments. And about half of them have also gone to community partners. So nonprofits that are doing this and other community partners that serve communities in different ways. Most of the brochures have been mailed out to organizations in Philadelphia. Almost 20% have been to organizations in Pennsylvania, and some have gone out of state, which is great to make sure that more people are getting the information. And as far as languages, people can request different quantities when they do the request. English is the most popular, but altogether we've sent out almost 20,000 brochures as of a couple days ago when this was compiled. And if you're curious about where these actually go, we did a kind of categorization of the organizations. It's a rough grouping to figure out like where would one find these, or what organizations are asking for them. And I think this may kind of answer the question about how this is being implemented at local domestic violence agencies, is that the organizations that have requested the most of these are domestic violence organizations at 15%, but they've also gone to libraries, health organizations, victim service organizations, organizations that work with immigrants, with people with disabilities, home visiting organizations that work with young families, substance use, homeless services, other outreach, and so on. So there's definitely more distribution to be done, but in the first couple months, this is where they have gone. We are asking people what they like about these, and if they have been using them. So so far, this is very new data, but most people have found that the brochures are very helpful and help their clients understand domestic abuse and know where to get help. And then I did see somebody ask for links in the chat, which I can't do at the same time of operating, but
I'm on it,
sharing
Liz.
again here.
You leave it up.
Great. So we've got more brochures that you can get here, the playlist here, and how to request here. There are other questions, or my other panelists want to jump in with any other last thoughts. I don't know if May is still on, but to the question about how this is being implemented at local DV agencies, I know that PCADV has shared with all of the domestic violence agencies in their network.
Yeah, and I just wanted to add that the resources, we had conversations about what resources we put on the back, and should we have the Philadelphia resources, but we have also the Pennsylvania resources, and we put every single county resources. So we decided to go to Pennsylvania national and Philly specific. So yeah, just wanted to share that.
Question about videos. So we do have, I'll show this briefly. We have 7 videos as of today out. The American Sign Language video has the highest number of views, I believe, at 122 views. So they are continuing to be shared. And I think what's interesting about this is that we designed these resources to be connected, but they can be shared independently, and I think are being shared independently. And some people may be just coming across these videos without having ever seen the brochures because they're just searching for this information. But all of them are available on our YouTube channel, Philly Office of Domestic Violence Strategies. And yeah, we can see that the French video, which I uploaded a day ago, has 17 views, but the videos that have been around a little bit longer have more views. So hoping to get these out into the communities. One interesting fact on the Portuguese video, which is different than all of the other videos on the back end side, I can see that the source of how people find this video is through WhatsApp. So as Susanna mentioned, especially immigrant communities may have different forms of formats for sharing information with each other. And this was shared during both the focus group and surveys with people who spoke Portuguese, that WhatsApp was a big way that they shared community resources and information. So I think over half of the views on this video come from the link just being shared in WhatsApp chats. So we're just about at time. There are other questions. You might be able to squeeze them in, or you can reach out to us. And you came to this webinar, you have my email from the Zoom confirmation, so you can send me an email, or we hope to get in touch with you. You have other questions about these resources? So thank you, everyone.
Thank you.
Thank you.